Judy Woodruff has more about one of the key questions, whether to include a public plan.
And for that, we turn to two people who've been closely watching this battle and making their case about this issue in their respective health care blogs. Ezra Klein covers domestic and economic policy for the Washington Post and recently the American Prospect. And Tevi Troy writes for the Critical Condition blog of the National Review. He served as Deputy Secretary of Health and Human Services during the second Bush administration, and he's now a senior fellow at the Hudson Institute. It's good to have both of you with us. We appreciate your being here. Let's start out and we know it's hypothetical. It hasn't come out of Congress. They're still negotiating. But Ezra Klein, if there were a public plan, who would run it? How would it work? How would it be different from the private insurance many people are used to now?
Well, I wish I could answer it more clearly. There's as many different public plans as there are bills. Some would be national, some would be run by states, some would be triggered by certain conditions not being met, as if in one condition, say, private insurers don't hold down costs, and then in 5 years a public plan comes into being. But the primary issue here would be a public plan would be not a private insurance plan, an insurance plan run by the government, available only, and this is important, people don't know it, on the health insurance exchanges. So available to those people who are able to buy these sort of new regulated markets that are at the beginning really only available to the unemployed, small businesses, and the self-employed.
So when we ask who's eligible, you're saying the unemployed.
Mm-hmm.
And
small businesses, certainly in the first couple of years, businesses under 10 or 20 people, the self-employed. But I work at the Washington Post. We're a large business. We get health care. I could not buy into the public plan because I could not get into the health insurance exchange.
But eventually the idea would be to enlarge it.
Some people have that idea and others don't. I mean, it is not built into the bills that would happen.
All right. Well, let me turn to you, Tevi Troy. How do you see? What's your understanding of what a public plan would be?
Well, I agree with a lot of what Ezra said, especially that it's vague. We're not really clear on what it is. I also agree with Ezra that there would be limitations at first, but then it would expand. And I think long term you would see government taking over more and more of the system.
As in Medicare? Is that what you're saying?
I think a Medicare model is likely. I think that something where you have the government as the payer setting the rules, determining who's in and who's out, determining what coverage is available and what products get covered. And I think that's an important point. Ezra has said in the past that one of the biggest problems with a public plan is what it does to innovation. It could stifle innovation if government chooses what products make it forward and which don't.
Ezra Klein, do the proponents of the plan agree that it's what Tevi Troy just described?
No, I also haven't said what he just described to me, so putting that aside for a minute. There are a couple different theories of what the plan would be, but at the outset, the plan actually under consideration is one insurance option that will compete among many. Tevi is correct that there are people out there who would like to see it grow, but it's very important to be clear about the mechanism here. The way a public plan would grow to be larger, grow to be like Medicare, which would be an incredible leap in growth, would be that it turns out to be cheaper and have higher quality than competing private insurance plans, and people choose it. The whole idea behind the public plan is that you can choose it, and that if it works well, it will either be a good choice for people or it will force private insurers to compete more efficiently and more effectively for consumer dollars.
If the idea is that it's available to more people and one can choose it, then Tevi Troy, tell me, what are the opponents, what is it that they object to about the plan?
Well, of course, again, at first, perhaps people can choose, and they are going to delimit it in certain ways at first is the idea. But my concern is that there's this issue of crowd out. When you have people looking at the system and they're in the private insurance plans and they start to bleed into the public plans and the public plan gets larger and larger, CBO is estimating...
What do you mean bleed into? You mean because it's more attractive in terms of rates?
They find it more attractive because the government limits the costs and because it subsidizes it. So people bleed into the system. They switch from the private coverage to the public option, and more people enter the government plan. CBO has found something like 80 million people would engage in this crowd-out type behavior.
All right. So now that we've heard some of the pluses and the minuses of what it might entail, Ezra Klein, who is in favor of it, and why are they in favor of it?
You know, the people you generally see pushing for it are not only Democrats, but consumer groups, folks who fundamentally believe that private insurance hasn't worked very well, that it has done too much to limit coverage, too much to price people out, too much to take health care away from people who needed it, too much to deny people who, came in and had a pre-existing condition. People who fundamentally believe the system we have isn't working. And one of the important things is interesting seeing what the Senate Finance Committee may put out here, the employer mandate and the public plan, because along with the employer mandate, the public plan is a wildly popular part of healthcare reform. That people really like the idea of having one more insurance option among many, because in recent years you've had incredible insurance consolidation, and most people just don't get much of a choice.
Well, I want to ask you about that in a minute. But Tevi Troy, the opponents, what do they not like about it?
Well, first of all, I'm not sure it's wildly popular because on Capitol Hill, a public plan does not appear to have the votes either in the Senate or the House to pass. So there are some questions about its popularity. The opponents don't like the fact that it would be a government plan that is Medicare, which is going to go bankrupt, as President Obama said in the set piece beforehand, in about 10 years. So it's extremely expensive. It could limit coverage. It could lead to rationing. I mean, you can ration, when you have limited resources, you can ration in only a certain number of ways. You can ration by line, which they do in Canada. You can ration by limiting products and availability, like they do in England, or you can ration by price, which is for the most part what we do in the U.S.
Having said that, how confident are you that it's completely off the table? I mean, there are reports today that it's off the table. The negotiators aren't looking at it anymore, at least in the Senate.
I'll say this. I'm confident that it's not going to pass before the August recess of public plan. So.
And what are you hearing about it, in terms of where it stands?
Well, the Senate finance negotiators aren't looking at it. It does exist in the Senate health plan, which was already passed out of committee, and it exists in the House bill, which has come out of 2 committees so far and is still working its way through Energy and Commerce. So I don't think it's anywhere near off the table. In some ways, I'd be surprised if you don't have something called a public plan in the final legislation.
And in terms of the political state of play, where's the balance now? I mean, is it the blue dog Democrats, the more fiscally conservative Democrats, as we just heard in Betty Ann Bowes' report, have not been for this, but they might be willing to go along with it?
You know, they might. I met with Nancy Pelosi last week for an interview, and she said she feels the Blue Dog Democrats accept that it'll be part of the final bill and are, trying to work their way through what the final form should be. So it's going to be very complicated to see. And one of the key questions you have to ask right now is who's going to have more votes and more power at the end of it. Many liberal Democrats, both in House and Senate, have sworn they will not vote for a plan that does not include a public plan. Well, I've actually not heard any sort of similar categorical denials from either centrist Democrats or Blue Dogs. So people generally expect that at the end the moderates will make the compromise, but you could really see dissension in the liberal ranks on this. How
do you size up the political prospects among the conservative, among the Blue Dog Democrats and Republicans?
Well, I certainly agree with that. There's going to be a huge push from the left for a public plan. In fact, Harry Reid said something like, whether you call it a co-op or a public plan, we're going to have some kind of government-run option in there. So there's definitely an insistence on the left that that be in there. That said, I think the Blue Dogs are very uncomfortable with it, and they've made it clear. I've done a lot of talk radio recently, and one talk radio host said that he, in 50 years of broadcasting, has never heard as much public anger as about this public plan. So I know there's some groundswell of opposition out there as well.
You said a minute ago whether it were a co-op, this is the nonprofit cooperative agreement. Are you saying that the conservatives would oppose it even if it were structured that way?
Well, the thing about the cooperative is that they're vague enough that it can be whatever people want it to be, or people can see what they want in the co-op. So I think there's a chance that a co-op can pass and it could bring some Blue Dogs on board. However, it could, in the end, be very much like a government-run option if government sets the rates, if government picks the people who lead it, and government provides the seed capital for it.
Recognizing we're still throwing terms around here that a lot of us, including me, don't completely understand. At this point, Ezra Klein, what do you think the prospects are? And Tevi Troy, how do you see the prospects?
Well, I think that I don't think they're going to make it through before the August recess.
But what about in the fall?
I think what happens in those 5 weeks in the August recess is going to be crucial, because if congressmen go back and basically have to wear flak jackets in their districts because of opposition to the public plan, then they might rethink this. However, there might be a push the other way. So I think it's up in the air right now. My bet at the end of the day is no public plan, but something does pass.
I think you're going to see something pass. I think you'll probably see it have a public plan. I think at the end of the day, healthcare reform ends up being something strong. And what Democrats remember from 1994 is that when they lost on it, they lost big in the following elections, and that was true for the sort of Democrats we associate with the Blue Dogs, and true as well for liberals. So I don't think you're going to see in any situation nothing go through. And at the end of the day, I think the public plan is popular enough to be embedded in the legislation.
In one form or another.
In one form or another.
Ezra Klein, Tevi Troy, thank you very much.
Thank you.